professor. This is 360 of my room. Okay, I want to set up my cell phone over here. Okay, my stethoscope. This is my ID clinical student. I just sanitize a little bit and then don the gloves. And then swap my stethoscope. Good. Okay, hello, my name is Shiva. I'm a nursing assistant in the Major Mackenzie Health. I want to do a head to toe assessment. Is that okay for you?
Yes.
Good. Okay, I want to make sure you are the right patient. Can I check your ID? Okay, please tell me full name.
William Overton.
Okay, date of birth.
19.
Perfect. Do you want to use a washroom before starting? No. Okay, this is a privacy. Do you have any concept for do that?
Yes.
Okay, good. Are you sitting comfortable?
Yes.
Perfect. Okay, the patients look like his age and then color of the skin color of the patient appropriate with genetic background. Can you please stand up? Okay, sitting back. Thank you so much. Okay, the height, the patient height is appropriate within the normal range and appropriate with his genetic background and then her genetic background and her age. And then I'm going to assess the body is symmetrical, proportion of each other, and have a good posture. The patient have a good posture. The arm are relaxed and sitting comfortable, and no obvious deformities, physical deformities. And then the patient have a good mood because she is cooperative and comfortable, and the clothes is appropriate with the weather. The dress is fit her bodies, and patient is clean and have a good personal hygiene. And then the patient have a good maintenance eye contact with me. And then can you breathe in, out, perfect. And then the patient's breath is effortlessly and no sign of doesn't show sign of distress. The level of conscience, can you please tell me who you are and time and the place?
I'm William Overton. The time is 12 noon and the place is hospital.
Perfect. The patient is alert and oriented. Time 3, state by correct time, person, and place. Good. And then I want to inspect facial structure, no lesion, no scars, and no redness, no involuntary movement, no edema, and no swelling. And then I'm going to do cranial nerve number 7, facial nerve. And can you please lift your eyebrow? Okay. Can you please poop out your cheek? Okay. Can you please smile? Show your teeth. Perfect. And then can you close your eyes? Perfect. I want to open your eyes again. Resistance. Okay, good. And cranial nerve number 7 is intake and symmetrical. And then I'm going to do inspect the eyebrow. The eye, first of all, I'm starting the eyebrow. Eyebrow is symmetrical. The eyelid is intact. The eyelash evenly distributed. No discharge coming out. The sclera is white. The conjunctive is pink. right eyebrow symmetrical, no discharge, no sign of foot leg, and then good. And then I'm going to do cranial nerve number 3, oculomotor. When I shine light on the patient eyes, um, the shape is round, the size is 4 mm within the normal range, and then the eyes are symmetrical. And then I'm going to direct a light reflex when I shine light on the left eye, the patient eye, the left pupil is constrict. And then when I shine light on the right eye, the right pupil is constrict. Okay, I'm doing to concentrate light reflex. When I shine light on the left eye, the right pupil is constrict. When I shine light on the right eye, the left pupil is constrict. Good. And then I'm going to do accommodation test. Please stay top of my pen. Okay, the both pupil are constrict, and the eyes are converging as the object approaches the eyes. And then cranial nerve number 3, oculomotor, is intact. And then I'm going to do inspect the air. The air is symmetrical and no discharge from out. And then nose is midline and no discharge from out. And then I'm going to inspect the mouth. First of all, I am starting lip. The lip is hydrated and no lesion. Can you please? And then I'm going to do cranial nerve test. Cranial nerve number 9, glossopharyngeal. Can you please say ah? Okay, when the patient say ah, the uvula and soft plate are raising. This is the cranial nerve number 9, glossopharyngeal, and the cranial number 10, vagus. And the cranial number 9 and 10 are intact. I'm doing to the test cranial nerve number 12. Hypoglossal. Please say ah. Please open your mouth. Okay. Please side to side your tongue. Okay. The tongue is midline. It's okay. Thank you. The tongue is midline. And please say light tight dynamic.
Light tight dynamic.
Perfect. And then the cranial nerve number 12 is intact and no tremors. Good. And then I'm going to do inspect the neck, inspect and palpate the neck. For inspect the neck, no lesion, no any obvious no lesion, no swelling, no edema, and no involuntary movement. For the palpation, do you have any pain?
No.
No pain. The temperature is warm, and then no sign of obvious, no obvious enlargement thyroid. And then I'm going to palpate carotid artery. The rhythm is regular. The greatest range is +2. The other side, the rhythm is regular. The greatest range is +2, and equal lateral, bilateral both sides. And then I'm doing test cranial nerve number 11, spinal accessory nerve. Please rotate your head toward, rotate another side. Good, strong shoulder, perfect. And the cranial nerve number 11 is intact. And then I'm going to inspect and palpation the upper extremities. For inspecting upper extremities, can you remove your clothes? Thank you so much. Are you comfortable?
Yeah.
Perfect. For inspect, no lesion, no masses, no edema, no swelling, no lesion and no scar. And for the other side, no scar, no lesion, no inflammation, no edema, and no involuntary movement, no joint inflammation sign. No joint inflammation sign. For the palpation, do you have any pain?
No.
Okay, the patient doesn't have any pain, and then the temperature is warm, no masses, and no tenderness. And then I'm going to radial pulse for 1 minute. I count radial pulse for 1 minute. The radial pulse is the rate is 80 beats per minute. The rhythm is regular and equal bilateral both sides. Thank you. And then I want to do a hand grab a syringe test. Please grab my syringe and squeeze. Okay, perfect. Thank you. The patient is able to squeeze my finger and grab a syringe test is symmetrical bilateral, and the test is intact. And then I'm going to wait. I'm going to lower extremity, and then first of all inspect. No inflammation, no joint inflammation, no involuntary movement, no tenderness, no scars, no lesion. For the palpation, do you have any pain?
No.
The patient doesn't have any pain, and then temperature is warm, and no masses, no edema, and no joint inflammation. And then I want to check anterior, posterior thorax first of all. Can you please rotate? Rotate completely. Okay, perfect. First of all, we inspect the posterior thorax. No scars, it's symmetrical, no involuntary movement, no lesion, and no redness. And then for the palpation, do you have any pain?
No.
No pain, no masses, the temperature is warm, and no tenderness. And then can you breathe in, out, in, out. The symmetrical chest, present symmetrical chest expansions and equal bilateral. And then I'm going to auscultate. Could you please breathe in, out, 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 in, out. Okay, good. No whizzing, no cracking sounds, and the breath is symmetrical and bilateral. The breath is symmetrical and bilateral both sides, and no extra sounds. Okay, can you rotate please? Thank you so much. And then I'm going to count respiratory rate for anterior thorax for 1 minute. I count. Okay, good. The respiratory rate, the rhythm, the rate is 20 breath per minute, and the rhythm is regular and equal by The rhythm is regular and strong. Uh, the respiratory is equal. No effortless, no effortlessly, and no sign of distress. Okay, good. And then I want to palpate the apical heart. The name is mitral apical mitral valve in the fifth intercostal space, and the left side midclavicular line. First of all, I count for 30 seconds. Is that okay for you?
Yes.
Good. Okay, and then I used to bell for hear any extra sounds. Okay, good. And the heart rate is 80 beats per minute, is regular, and then the rhythm is regular. Strange grade is +2, and then no any extra audible sounds, hard sounds in S3 and S4s. And then can you please line? I want to inspect and palpate the abdominal. Okay, I'm doing the privacy. And then she has a bra, we don't need the privacy here. And then for the and first of all we inspect the umbilicus is midline, and then no scars, no redness, no involuntary movement, and no lesion, no scars. Is midline.
Sorry.
Bless you. And then I want to auscultate a certain lower right. I want to hear sounds for vowel sounds. Okay, high pitch graggling sounds in the fourth quarter is present in the four quarters every 10 seconds, and then I want to palpate. Is that okay for you?
Yes.
Okay. Do you have any pain?
No.
No, don't have any pain. No tenderness, and no superficial masses. Thank you for cooperative. You can. Okay, thank you so much. I'm done. I had today's assessment.